So prior to the pandemic, which sounds like a lifetime ago now, we set up the initiative to look at the services across the UK of MS services. So we all knew through anecdotal conversations with colleagues that everyone run their MS service differently, but there was no real feel for what that actually meant. Like you might know what your friend was doing around the corner, but you didn't know what that meant in the UK. So we thought, well, actually, we don't know what we're doing now. How do we know what we need to do for the future? So we asked some simple questions. We asked questions like, well, actually, how many patients do you have? And actually, when we ask that question, now, if you are sitting there as not working in a service, you're thinking, well, everyone knows the answer to that question. You'll be surprised at how many people don't know the answer to that question. So we also asked, the follow-on is, how accurate do you think your number is? So everybody in the country can give a number for how many patients their service looks at. And everyone does annually in the different surveys that are done by the different organizations. But when you ask people how accurate is your number, you'll be surprised at how many people it's a complete guess, and actually they could be out by quite a wide factor. Now, the NHS, you'd think with a national healthcare system, would be technology enabled. And there are lots of initiatives to try and make us more IT enabled, etc. And some are more successful than others. There are MS services running on pen and paper, running on notebooks. There are MS services running that fully technology enabled. The consultant will have 3 screens in front of them and everything it looks like they're in Starship Enterprise and it's amazing. But actually, how do you move everyone forward? So it's all great saying to the people that technology enabled, oh, you need to be able to do this more. Well, actually, what about the people using pen and paper? Actually, just getting them to using a computer will be a good start. But actually having a shared drive, having a shared Excel, having a shared database, which everyone inputs into, is a real stumbling block. And actually some of this is outside of the MS team's control. It's down to trust or local commissioning. But actually, how do we enable everyone to work going forward? So we asked a range of different questions in our survey, and the surveys were very in-depth. They started off with what was a Google survey that went out saying, oh, just answer these questions. And then we realized, actually, this is way more complicated than this. We need to speak to people. And on speaking to people is when you got a real feel for how people were coping. And one, I think, the most interesting questions we asked was, how do you as a service feel you are coping? And no service in the UK felt they were coping well and were giving adequate services to the patients that they provide service to. And that is no fault of the healthcare professionals involved in those teams. Everyone wants to be doing a good job. And one good thing about the pandemic is it allowed people to be more honest about the services they were providing for their patients. Everyone knew they wanted to do better, and they didn't, but they didn't know how to make things better because they felt their hands were tied. And you get so caught up in the day job that how do you improve? And in the past, people have tried to improve their services in a very piecemeal way. So if you improve service X and you go and you get grants from different organizations, you get research grants, you might get your NHS Trust to invest, you might get your local commissioners, service X improves. Service Y might be next door. So every patient at service Y looks at service X saying, I'm going to go to service X because they've got that amazing service. So then you're breaking service X because they haven't actually got the capacity to cope with all of this influx of patients. But service Y falls down because no one's investing in them because they haven't got the patients. So we have realized as a community, you can't invest in service by service. We need to improve the whole community. So one, it improves the care of every patient in this country, leaving no patient behind. So you're not just enabling those patients that are able to choose and travel and find out where the best services are to get the best service. We're improving the care of all patients across the country. So we did not want to widen any health inequalities, and that is the work going forward. We've done a report. It says we don't have enough staff. It's due for publication, and that is in progress. But it is a case of there's hundreds of reports saying we don't have enough staff. We're not providing the care we need. We need more money, investment in staff. But actually, what is different about this work, it is now when the work starts. We have now come up with some distinct projects that we can work together as a community to work together to make things, improve things for the patients living with MS and the teams delivering that care. Because unless you improve both sides of the coin, it doesn't improve the care overall.